Yes. So Ayurveda Ithiasa continued class. Last class we discussed about Charaka Samhita and salient features of Charaka Samhita. Who is the Tantrakarta of Charaka Samhita? Agnivesh. Okay, unmute and answer fatafat. Fast questions. Prajisamskarta of Charaka Samhita? Acharya Charaka.
Dridabala.
Sampuraka of Charaka Samhita?
Acha.
Drudabala. Okay. So Adhyapadishta of Charaka Samhita? Punarvasu Atreya, Krishna Atreya, Bhikshu Atreya, Atreya. Who is the Adhyapadishta of Charaka Samhita? Punarvasu Atreya. We have to take a clear word, Punarvasu Atreya. For example, in MCQ, if they are asking about what is your name, so your name is Santosh Kumar, Santosh Kumar H. So in first option there is Santosh, second option Santosh Kumar, in third option Santosh Kumar H. So you have to select option C only. Okay. So the same technical word you have to select in MCQ solving. Otherwise you will be wrong. So many times the options are misguiding you in selection. So that's why I told you in MCQs, question is not much difficult. The options makes the question difficult. Okay. I will repeat, the options makes the question difficult. You have to listen, you have to analyze the options carefully before selecting for the answer. Okay. So come to Sushru Samhita. Who is the Adhyapadishta of Sushru Samhita? We discussed it in the first class only. Adhyapadishta of Sushru Samhita. Kashi Raja Divodasa Dhanvantari. ನೀವು ಪಟಪಟ ಅನ್ಮ್ಯೂಟ್ ಮಾಡಿ ಹೇಳ್ಬೇಕು, ಇಲ್ಲ ನಾನು ಮೂವ್ ಆಗ್ತೀನಿ. ಓಕೆ. ಸೊ ಹೂ ಇಸ್ ಅಧ್ಯಾಪಕ ಸುಶ್ರು ಸಮೇತ? ಕಾಶಿ ರಾಜ ದಿವೋದಾಸ ಧನ್ವಂತರಿ.
ದಿವೋದಾಸ ಧನ್ವಂತರಿ.
Yes. Tantrakarta of Sushru Samhita. Tantrakarta of Sushru Samhita. Sushrutha only. So in some references we had a reference that Ruddha Sushrutha. Okay. Who is the Pratisamskarta of Sushru Samhita? Pratisamskarta. Again Sushrutha only.
Yod.
Okay. Patashuddhikarta of Sushru Samhita. Chandrata.
Divodas Dhanvan Chandratas.
Chandrata. Patashuddhikarta is Chandrata. In some context, Pratisamskarta is Nagarjuna. So in Sushru Samhita it's clear. Adhyopadishta is Kashi Raja Divodasa Dhanvantari. Tantrakarta is Ruddha Sushruta. Pratisamskarta is Nagarjuna. And Patashuddhikarta is Chandrata. So out of these, very frequently they will ask the question, who is the Patashuddhikarta of Sushru Samhita? Chandrata. Okay, ಅದೊಂದು triple star question. No? So usually we'll miss the name Chandrata. So remember, the Patashuddhikarta of Sushru Samhita is Chandrata. Okay. Who is the father of medicine? Who is the father of medicine? Father of medicine. Father of medicine. I will give you two options, not four options. One is Acharya Charaka. Another one is Hippocrates.
Hippocrates.
Hippocrates. The whole world accepted father of medicine is Hippocrates. Okay. Who is father of surgery?
Sushrutha.
There is no controversy in the father of surgery. The modern allopathy, homeopathy, so all system of medicines all over the world, Arabic medicines, any European medicines, all system of medicines existed all over the world, accepted Sushruta anonymously as a father of surgery. Okay. In Oxford School of Medicine in London, there is a big statue of Sushruta. In the bottom line, they are written. So this is Acharya Sushruta, is a father of surgery. Okay. In Australia, also in medical schools, in every medical schools, there is a statue of Sushruta, and the baseline they are written, he is a father of surgery. He is a surgeon from India, and he whole world unanimously accepted Acharya Sushruta as a father of surgery, no doubt. In history of medicine books also they written father of surgery is sushrutha. So without any controversy, without any ambiguity, the father of surgery is sushrutha. Okay, so no doubt in it about the father of surgery. So Acharya Sushrutha is the father of surgery. So when come to some of the salient features of Sushruta Samhita, who is the father of Sushruta? Father of surgery is Sushruta. Then they're asking about father of Sushruta. Sushruta is the son of Vishwamitra. Just for notice, in some question paper they ask the question also, who is the father of Sushruta also. Sushruta is the son of Vishwamitra. Just take down. Sushruta is the son of Vishwamitra. When come to salient features of Sushruta Samhita, some specific specialized features of Sushruta Samhita, there are a lot more to tell about Acharya Sushruta. So, because he is the first person and he is the father of surgery, invented lot in his lifetime when come to the surgery, and many special features explained in Sushruta Samhita regarding surgical schools. Okay, so in that manner, the first one chapter we can select from Sushruta Surasana is Yogya Sutriya Adhyaya. Okay, so Yogya Sutriya, it will tells about a trial surgery. Okay, so it will explain about a trial surgery, how we have to practice surgery before starting the surgery with a human being or a model or a subject directly. So how to do the trial surgery. Okay, so we have to do the suturing on a cloth. We have to do the incision on the animal skin. So like that. So and then incisions on vegetables, excisions on vegetables. Okay. So like that, lot of clinical surgical trials Acharya explained in that chapter. Yogya Sutriya there. This is the foremost and first thing to be documented in any of the ancient books. Okay, in olden books this is the first one. So no other books has documented this type of explanation, trial surgery. Usually in Ayurveda colleges, we don't have these trial rooms or trial surgery rooms. So in MBBS, it is compulsory. So they have to make a clinical surgery and trial surgery rooms. There they will have a mannequins. So instead of the human beings, they have a mannequins. They will do the incision, excisions, and injections, and parectal examination, paravaginal examination. Everything they will do it on the uh, mannequins. Okay, so dummy human bodies. So with that only they will get a experience. But in our curriculum, we don't have the chance to do it. But if you visit a medical college, you can see the trial surgical rooms. Okay. So very neatly they will explain. We witnessed when we are visited Kasturba Medical College, Manipal. Okay. So there are a lot of mannequins. We did lumbar puncture with the mannequin. We have given injection to the mannequins, even intravenous injections, intramuscular injections, everything they will do on mannequins. Okay, so before going to human trials, they will do the trials on mannequins. Okay, so that is a very good thing. But in our Ayurveda classics also, we have a reference in Sushu Samhita regarding trial surgery. Okay, it's a very good thing if you did any Shalya in your future. So make sure that all your students should learn surgery according to Yoga Sutriya Adhyaya. So we have studied in the book, but in our colleges nobody will taught us these trial surgeries except suturing. We did suture with the cloth except that one. So all these things should be came into a practical room. Okay, all vegetables should come to the practical room. So make sure that it should be done in a colleges. Okay. So next is Yukta Seni Adhyaya. So Yukta Seni Adhyaya, a specialty of Sushu Samhita is a war room medicine. Okay, recently we witnessed a war between India and Pakistan. It is a different war. But in olden days, the war is between a 1 to 1 person. Okay, a lot of casualties will happen. So, a lot of injuries, a lot of fractures. Okay, so and many times they will lose their life also. Okay, it is Yuktasenia, there is a war room surgery. So, immediately what to do to save the patient. Okay, so even when hand is cut, when head is cut, so fingers are cut. So, how to rescue the patient? That is a Yuktasenia Adhyaya. Okay, the war medicine was explained. Even these war medicines was copied to Arabic countries. So usually you know about Alexander and other invaders. So and even Mughal invaders in 10th century to 20th century AD. So they will come and they will invade one area and they will defeat the king, and whatever the physicians are there with the king, they will take the physicians with them. Okay, so surgeons and physicians and medicines with them. This was documented in one of the famous journals, Himalaya journals, and many journals. They documented this thing. Okay, our Ayurveda spread to all over the world through the invaders also. Even Alexander taken our physicians and medicines, all technology they will taken out, and even the books they will taken out and they will translate it to their native languages. All these things will happen when the other foreign invaders came to India. Okay, so this not only an emergency medicine to be practiced with the Senia, but also how to survive in a forest region. Sudden snake bites will happen, sudden animal attack will happen when they are going towards the forest. In olden days, almost 80% of the earth is covered with the forest. Only 20% will be the suitable area for living, that is the villages and cities. Well, almost all 80% is covered with the forest. Now only 40% is covered with forest. Remaining 60% is occupied by human beings. Okay, so in olden days, their atmosphere is different. So a lot of animals attacks, animal inventions happen. So how to survive all these things, and even when they are coming in the forest areas, lot of poisoning will happen. Okay, they will mix the poison to the water. Okay, they will mix poison to the air. They will mix poison in the trees. That is documented in Chanakya Artha Shastra. Okay, Chanakya Dandaniti or Chanakya Arthashastra, it is well documented. So how to poison the places. Okay, even to kill the king, they will use poison in chappals. They will use poison in the clothes. They will use poison in almost all the things utilized by a king. Okay, so all these things is explained in that Chanakya Dandaniti. So, but Yuktasenia, there is an excellent chapter here. Acharya has explained about the war medicine. Okay, the emergency medicine. It means to say that the emergency surgeries and emergency medicine. And Sushrutha is not only father of surgery, he is a father of plastic surgery also. Okay, he is the first one to did a plastic surgery. So replaced the nose and corrected the cleft lip. Okay, so till today, the most challenging surgeries are plastic surgeries. Okay, so with all these specialties, with higher antibiotics, with all aseptic preparations, and very good OTs, operation theaters, till today, so they are fighting for a success in plastic surgery. But in olden days, that we imagine 2500 years back, Acharya succeeded in doing a plastic surgery and correction of a cleft lip, replacement of nose. So it is an excellent and wonderful thing they documented in samhitha. Okay, so he is the one and first person to do the plastic surgery. And very common thing is Shavachedana Vidhi. One more important thing for Arya Sushita did is dissection. So he is the first person to do the dissection. Okay, so no other books has documented dissection uh, in any of the classical text, even in modern books also during that period. Okay, so even Hippocrates was not at all born, during that period also Acharya did all these things. Okay, so dissection and preservation of a dead body very clearly and very extensively has given detailed explanation regarding Shavachedana Vidhi and as well as preservation of the dead body. Okay, so we will discuss in detail about Shavachedana Vidhi in Shari Rachana, but he is the first one to do that, Shavachedana Vidhi. And in many times we don't know about Muda Garbha, whether it is a tumor, whether it is a baby, and Mruta Garbha also. So Muda Garbha is a different concept, and the Mruta Garbha is also a different concept. So they don't know whether the baby was died inside the womb or not, how to deliver the baby. Many times the baby and as well as mother both will die because of all these complications, sepsis and all these complications. But Acharya Sushrutha found out a solution to that. So he did a Kukshipatana. Laparotomy, he open an abdomen and will take out the dead baby or else Mruta Garbha or else any other Muda Garbhas, okay, or else any tumors and other things. He is the first one to do did it. Okay, so the Kukshipatana in Muda Garbha is a new concept and first and foremost thing to be documented in ancient books. And Jalasantrasa, hydrophobia. Till today, there is no medicine for rabies. So we have very advanced, we are living in a very advanced era that will be in 21st century in AI mode. Artificial intelligence is ruling everyone, but still today we don't have a medicine for a rabies. Okay, during the era of Sushruta also there is no medicine for rabies. Okay, so Acharya Sushruta documented the rabies and rabies complication just like Jalasantrasa. It is hydrophobia. So hydrophobia in the name of Jalasantras. Okay. So Alarka Visha, and he has mentioned Datura Mula as a drug of choice in case of Alarka Visha. In dog bite poison, Acharya advised to take Datura Visha, Datura Mula. Okay, the concept is very clear. There is a Jangama Visha. Jangama Visha is Alarka Visha. Alarka Visha is a animal poison. For animal poison, we have to use herbal poison to nullify the animal poison. So that concept was very good. The herbal poison is opponent to animal poison. Herbal poison and animal poison are opposite. So this concept is there in Agada Tantra. The same concept is used by Acharya Sushruta and he made a medicine for hydrophobia, Jalasantrasa. Same thing we have discussed many times during COVID. Okay, so we don't have many people will tell we don't have medicines for COVID. So it is not like that. We have a documentation in ancient samhitas and in Sushruta Samhita. So in Jalasantras and other Kavisha, Acharya used Datura Visha. So like that we have planned some Kanakasava in COVID. We have given other medicines. So Tulsi Ardhaka and Datura combination. Tribuna Kitrasa we have planned. Okay, so like that, a lot of Sanjeevani you have planned, which contains Balatakan Vatsanabha as one of the ingredients. So like that, lot of medicine we have planned for COVID and we have succeeded in it also. All these concepts are from Acharya Sushruta. Okay, so first and foremost Acharya to document regarding so Jalasantrasa and Alarka Visha. Okay, and Shed Kriya Kala. We are all know about Trivida Kriya Kala and Swabhava Paramoda of Charaka. So Sanchaya Prakopa and Prashamana, that is Swabhava Paramoda of Charaka. The same thing we documented in Sushruta is Shed Kriya Kala. The detailing of these Trivida Kriya Kala is Shed Kriya Kala. Sanchaya Prakopa, Prasara, Sthana Samshaya, Vekta and Veda. Okay, so in Charaka we have only three Kriya Kala. Yavyadu Kriya Kala, Sanchaya Prakopa and Prashamana. Same thing in detail explanation about this Trivida Kriyakala and Shed Kriyakala, that to be in Rana. Okay, where Acharya explained about Shed Kriyakala in Rana Chikitsa. So, Sushruta Sutrasthana, 21st chapter, the name of the chapter is Rana Prashna Adhyaya. The name of the chapter is Rana Prashna Adhyaya. So, there also Acharya is asking a lot of questions regarding Rana. How Rana will occur, what are the treatment principles in Rona, what are the medicines to be used in Rona. Like that questions will be asked in the beginning. Later on, Acharya is answering to these questions. So in that manner, he has given Shed Kriya Kala. So first how dosha will get sanchaya, then prakopa, then prasara, then sthana samshaya. In sthana samshaya avastha is dosha sammurchana avastha is sthana samshaya. So where dosha and dusha will get merged and dosha will do the damage to the dusha, that is sthana samshaya avastha. So after sthana samshaya we will get a rupa, vekta, and then veda avastha. So all these things the Acharya is explained with an example of Rona. Okay, so it is explained in Sushrutha Sutra Sthana, 21st chapter. The name of the chapter is Rona Prashna Adhyaya. Okay, so though Acharya Charaka and Vagbhata, they belong to medical school of thought, we don't have any explanation regarding the Shedkriya Kala. So Acharya Sushrutha belong to the Nonar Sampradaya and surgical school of thought. He has explained in better, in a minute, fractional detail about these Shedkriya Kalas. How the things, how the pathogenesis will happen. Okay, so that is the base for our Roganidana. The whole base for Roganidana is Shadkriya Kala. These things explained in Sushu Samhita, not in Charaka Samhita. So one phrase is there in medical school. So who is called as a best physician? Who is the best physician is? Surgeon is the best physician. Okay. The phrase in medical schools is best physician is surgeon. Surgeon is try to avoid the surgery by utilizing all the medical means, all the medicines. Okay, so surgeon is the best physician, not nowadays. So nowadays, if you go to surgeon, they will plan for operations only, not to give medicines. Okay, so in olden days, surgeon is try to avoid the surgeries because the specialties are very less in olden days, the OTs are very less in olden days, medicines are very less in olden days. They try to avoid surgeries. Okay, nowadays we have a lot of specialties, lot of doctors. They don't have a job to do it. So definitely, if you go to the surgeon, definitely they will do the surgery. Okay. This Shadkriya Kala is a very unique concept explained in Sushruta Samhita Rana Prashna Adhyaya, Sushruta Sutra, 21st chapter. In Dushodhara, Acharya told Vanaspati Visha Prayoga. In Dushodhara, Acharya Sushruta told Vanaspati Visha Prayoga. And explanation of Pancha Pancha Moolas, it's also explained in Sushu Samhita. And the concept of Vishakanya, already I told regarding Chanakya Dandaniti and all. So, Chanakya was lived before these books was written. Okay, many influence of Chanakya in Charaka Samhita also, in Sushu Samhita also, in Vagbhata Samhita also, regarding Vishakanya. So the concept of Vishakanya is basically from Chanakya Dandaniti. Okay, so he is the first person to develop this Vishakanya. But in classics, when come to an Ayurveda Bruvatrais or Lagutrais and Ayurveda textbooks, so Acharya Sushruta is the first one to know about this Vishakanya, and he documented the symptoms of Vishakanya and how Vishakanya will be developed. All these things will be very neatly documented in Sushruta Samhita. And regarding Upasarika rogas, communicable diseases. Okay, so COVID-19 is an Upasarika roga, the Janapata Dhamsa roga. So how these diseases will spread and what are Upasarika rogas? All this shloka is first and foremost documentation therein Sushruta Samhita. And Shadupakramas in Rona. So in Charaka Samhita we have only 36 Upakramas in Rona, but in Sushruta it is 60 Upakramas. Shadupakramas in Rona. So just check it out. Almost all treatment principles is there in Rona Chikitsa. All possible treatment Acharya documented in Rona Chikitsa. No treatment left in Rona Chikitsa. So if you are good in Rona Chikitsa means you can able to treat any disease in the world in any form. Okay. So all the treatment principles, protocols, everything he has mentioned in Shadopakrama. Even Panchakarma is included in Shadopakramas. Okay, so it's a very beautiful concept and explained. So usually during UG, you're not at all well versed with these Shadopakramas. You just read all 50 Upakramas with all medicines. Definitely, you will adopt these Shadopakramas in your clinical practice. You will succeed. Okay, so Acharya explain these Upakramas only to treat Rona. So you think how Rona is important, how Rona is killing the people. Till today, we are facing a lot of difficulty in managing diabetic wounds and varicose wounds. Okay, so varicosity wounds are very difficult to treat, and diabetes wounds are very difficult to treat. Even we are struggling the 3 months, 6 months, 1 year also to treat varicose ulcers and diabetic ulcers. But by adopting proper method like Shadopakramas, so we can able to manage it. Okay, it's a wonderful explanation by Acharya Sushrutha. 60 Upakramas in Rana. So note down, 60 Upakramas of Rana is a unique concept of Sushrutha method, but it is not at all mentioned in Charaka Samhita. Charaka Samhita is 36. Acharya Charaka has mentioned only 36, 36 Upakramas, but Sushrutha 60. And in Charaka Samhita, which is called as Chikitsarda. Chikitsarda.
Nasya.
Illa Basti. Acharya Charaka considered Basti as a Chikitsarda. Acharya Sanshudha considered which is Chikitsarda according to Acharya Sanshudha?
Siravyadha.
Shiravedana.
Yes. Siravedana is Chikitsarda according to Acharya Sanshudha. So you just go through Vatarakta Chikitsa. Okay. In Vatarakta Chikitsa, Chikitsa Sutra, first and foremost Chikitsa Sutra is Basti and followed by Siravedana. So in Vatarakta, Acharya utilizing both the best treatments. Adha Chikitsa is Basti, remaining Adha Chikitsa is Siravedana. So it becomes Purti Chikitsa. In any disease, if the patient is eligible for Basti, if patient is eligible for Siravedana, you can do it wonderfully. There are wonderful results with Basti. Okay. So in my beginning days, usually I won't practice Basti much because of patient also hesitate to take and a lot of complications and lot of expenses will be there in Basti preparation and Basti giving. But one day, so the patient is with low backache, a severe low backache. We have planned Churna Basti in the beginning and followed by Eranda Mula Kashaya Basti. So, you know about Churna Basti is a very unique contribution of Acharya Chakradatta and Yoga Ratnakara. There we have Churna Basti. Churna Basti is a type of Basti we are used in case of Hama. Wherever you will get a severe Hama conditions, in case of Hama Vata, so Amavata like conditions, seronegative arthritis or gouty arthritis. In these conditions, in first and second Basti will give as a Churna Basti. When go through the Churna Basti ingredients, so we have Eranda Taila is there in Churna Basti, and then Vaishvanara Churna is there in Churna Basti, along with Gomutra. Okay. So I told my therapist to give Vaishvanara Churna, add some, take 10 ml of honey and 10 grams of Vaishvanara Churna, and some 40 ml of this one, Gomutra. So make a, and add some 300 and 400 ml of water and give it directly. So the concept is very clear. Vaishvanara Churna is Amapachaka, Deepana Pachana, and Gomutra is Amapachaka. So, and Kapha Kledaka and Kledahara, all these effects will happen. So, we have very good results with Amavata patients and other things. So, I told my therapist to do it. Then he did it. Then I got a call from a patient, sir, I have a severe vomiting since 1 hour. So, I thought you have had any infections and you may be troubling with your daily routine foods and other things. And after 2 3 hours, yeah, it has subsided. Okay, so vomiting started from the morning and it has subsided after some 7 to 8 bouts of vomiting in the night after he taking some anti-emetic drug. Okay. So after that, in second day also one more patient, we are also advised same Churna Basti to the patient. The first Basti Churna Basti. Again, the patient also started complaining about, sir, I have severe vomiting. Oh, then I thought there is something happened in Basti, Churna Basti. So the patient is having severe vomiting. So then I started inquiring with the therapist. So what are all you are given to the Churna Basti? Come and show. Then we went to the preparation room and saw instead of Vaishwanara Churna, my therapist added Vacha Churna. So Vacha is a emitting drug. And how much he has used? Only 10 grams. If we give 10 grams of Vacha orally, nothing will happen. Okay. So max to max, patient may get one vomiting maximum. So usually we are using Vacha in case of regular Vamana along with Madanaphala, Vacha, Estimadu. So not much vomiting will happen with this. So same thing we are used in the Basti, that will be only 10 grams, more than 10 times vomiting happen. Then you can think about the Karmukata of Basti. So till then my clinical practice in hospital was very less utilization of Basti. After that, very extensively I started using Basti. Every patient, yes, you are not comfortable, you can go for Basti. Okay, so it is 100 times potential than that of any oral drug. Basti is not one time or two time, it is 100 times potential than that of any other Panchakarma procedure or any other oral drugs. Then after that, we are start giving all medicines through the Basti. So if Pakshagata patient come, we will give BVC tablet through the Basti or Ekanga Virasta through the Basti. If Amla Pitta patient comes, if Basti is advised, we are advising Sudhashakara through the Basti. So whatever the disease, based on that, the oral medications we are started mixing with the Basti. So excellent result we are getting from the Basti. If you are practicing Basti, so definitely we are getting very good result. This is one example I am giving. So lot of improvements will happen through the Basti. Even in case of disc bulge, diffuse disc bulge cases, L4, L5, L5S1 bulge with sciatica cases, and herniation cases. And we have utilized Basti in almost all cases. So either external therapy or internal therapy. At least if patient comes, we will give Matra Basti minimum. So in primary practice, we used to give Virechana. Whatever patient may comes, at least one Sadhya Virechana also I will advise him. But after this incident, we started giving Basti for every patient. Okay, if they are willing, we'll go for Kashaya Basti. Otherwise, at least some Matra Basti will give. Okay, so Vata Prakopa is a very common condition in day-to-day practice. So any Vataja diseases, definitely we're advising Basti. So we think Vata Prakopa is not happened in the body, it is happened in the mind. So everybody is in the stress. Okay. So nowadays, all the diseases are not from physical exertion. All diseases, whatever patient is getting is mental exertion diseases. Okay. So not physical exertion, these are all mental exertion diseases. Stress will be the common cause for all diseases. Unique feature. Stress is the cause for all diseases. Without any other pathogenesis, stress will going to kill the patient. Cancer, stress. Autoimmune diseases, stress. Diabetes, stress. Hypertension, stress. Fatty liver, stress. Insomnia, stress. Okay. So whatever may be the disease, the etiology is stress only. Okay. So Vata Prakopa will happen. What happens in stress? Vata Prakopa only. For calming down the stress, we have to control Vata. How to control Vata? Basti. Best treatment for Vata is Basti. So that's why Acharya Charaka called Basti as a Chikitsa. Okay. And Sira Vedana also we are getting excellent results in Rasa Raktagata diseases. Whatever Rasagata Raktagata diseases comes, go for Sira Vedana. Without any second opinion, just go with Sira Vedana. Okay. So in my clinical experience of 15 years, I've seen more than 50,000 patients in 15 years, and we have treated 95% with Ayurveda medicines only. So in that main culprit, the main organ to be damaged in day-to-day practice is liver. Okay, the main cause of diabetes is fatty liver or liver metabolism abnormality. The main cause for dyslipidemia, cholesterol, liver only. The main problem with hypertension, liver only. The main problem for acidity, liver only. The main problem for indigestion is liver. Main problem of constipation is liver. Okay, so liver is the second most organ to respond for emotions. Okay, first is brain, second is liver. Okay, so liver diseases are the third common cause for death. Okay, so in that case, Yakrut is Raktavas Roto Mula. If you do Siravedana, automatically the Mula will become free from all these toxins. Okay, so then we have started practicing whatever patient may come, we started with Siravedana. Okay, so one 18 ml, 18 gauge needle we will keep ready. And when patient comes, 1 cup and 18 kg needle. So expenses is 5 rupees. We'll charge 500 rupees for Siravedana. Okay, fatafat relief. The pain, inflammation, and detoxification, everything will happen with Siravedana. Even for bloodletting, even for laboratory investigations, we told patient to give blood from right hand only. Middle cubital vein of right hand is the Siravedana spot for any Yakrut Vikaras. They are not willing for normal bloodletting 50 ml to 150 ml. So we advise the patient to give blood test through the same right hand only. So wonderful results with Siravedana. Okay, in Delhi, one in Jamia Masjid. So morning, everybody, almost all, whatever the skin disease and chronic diseases, they will come with a 2 rupees blade and they will stand in front of the masjid. And one person, the technical person, he may be the priest of the masjid, is coming and he just uh, did cut the vein and it will go. He will go. A sudden, complete rush of blood will come. So 100 to 150, and he give the cotton also. After some time, they will press it up the cotton, and the blood will stops. Okay, it is in a common folklore practice happening everywhere. Siravedana is an ultimate treatment. So that's why it's called as Chikitsarla. Any pain, inflammation, acute conditions, so the blood will go into Vikruti. So in Rakta Vikruti, the first and foremost treatment principle we can adopt is Siravedana. Okay, excellent result. So if you want to practice Ayurveda, practice Siravedana and practice Basti. Remaining all treatments are add-ons only. Okay, so Basti is Chikitsartha, Siravedana is Chikitsartha. Then it becomes complete treatment. Whatever may be the disease. If you want to give complete treatment, Basti 50%, Siravedana 50%, becomes 100. Results ಬಂದೇ ಬರುತ್ತೆ. So you don't know the disease, pathogenesis, everything, not necessary. Only by doing these two, 100% result. 100% treatment means 100% result. Okay, plan accordingly. And Tailadroni in Bagna.
Sir, one question.
Yeah, doctor.
Without Panchakarma, how to purification our body, sir? Any idea, sir? Without Panchakarma. ಈಗ ನಮ್ ಪಂಚಕರ್ಮ ಇಲ್ದೇನೆ ನಾವು ಬಾಡಿನ ಶುದ್ಧಿ ಹೇಗೆ ಮಾಡ್ಕೊಳ್ಬಹುದು, ಅದೇ ಏನಾದ್ರು ಚಾನ್ಸಸ್ ಇದೆ ಇರುತ್ತೆ ಸರ್?
ಧಾತು ಪಾಚಕಗಳಿದ್ದಾವೆ. ವಿಷಮ ಜ್ವರದಲ್ಲಿ ನಮ್ಗೆ ಆಚಾರ್ಯ ಟೋಲ್ಡ್ ಪಾಚಕ ರಸ ಟು ಅಸ್ಥಿ ಮಜ್ಜ ತನಕ ಪಾಚಕಗಳಿದೆ.
ಬಿಕಾಸ್ ಸಮ್ ಪೇಷಂಟ್ ಹೆಸಿಟೇಟ್ ನೋ.
ಎಸ್ ಎಸ್. ಸೊ ಅವ್ರಿಗೆ ಸದ್ಯ ವಿರೇಚನ ಹೇಳ್ಬೋದು, ಸದ್ಯ ವಮನ ಹೇಳ್ಬೋದು, ಬಸ್ತಿ ಎಲ್ಲ ಬೇಡ ಬೇಡ. ರಕ್ತ ಮೋಕ್ಷಣ ವಿ ಕ್ಯಾನ್ ಡೂ ಇಟ್ ಇನ್ OP ಲೆವೆಲ್ಸ್. ರಕ್ತ ಮೋಕ್ಷಣ ನಿಮ್ಗೆ ಒಳ್ಳೆ ಸೆಟಪ್ ಬೇಕಂತಿಲ್ಲ. ವಿ ಕ್ಯಾನ್ ಗೋ ವಿತ್ ವಿದ್ಯಕರ್ಮ, ಅಗ್ನಿಕರ್ಮ. ಪ್ಯೂರಿಫಿಕೇಶನ್ಗೆ ಪಾಚಕ ಧಾತು ಪಾಚನ ಇಸ್ ಬೆಸ್ಟ್ ಟ್ರೀಟ್ಮೆಂಟ್. ಧಾತು ಪಾಚನ ನಮ್ಗೆ ಇದ್ರಲ್ಲಿ ಕ್ಲೆನ್ಸ್ ಆಗುತ್ತೆ, ಇಂಟೆಸ್ಟೈನ್ ಕ್ಲೆನ್ಸ್ ಆಗ್ಬೇಕು. ನೋಡಿ, ಪಂಚಕರ್ಮ ಮೈನ್ ಏಮ್ ಆಫ್ ಪಂಚಕರ್ಮ, ವಮನ ವಿರೇಚನ ಅಂಡ್ ಬಸ್ತಿ ಇಷ್ಟು ಕ್ಲೆನ್ಸ್ ದ ಇಂಟೆಸ್ಟೈನ್. GIT ಕ್ಲೆನ್ಸಿಂಗ್ ಇದೆ. ಓಕೆ, GIT ಕ್ಲೆನ್ಸಿಂಗ್ ನಾವು ಸದ್ಯ ವಿರೇಚನ ಆದ್ರೂ ಕೊಡ್ಲೇಬೇಕು. ಸೂಪರ್ಫಿಷಿಯಲಿ ಡೀಪ್ ಅಲ್ದಿದ್ರು ಸೂಪರ್ಫಿಷಿಯಲಿ ಕ್ಲೆನ್ಸಿಂಗ್ ವಿಲ್ ಹ್ಯಾಪನ್ ಥ್ರೂ ದ ಸದ್ಯ ವಿರೇಚನ. Classical virechana, if they are not willing for classical virechana, at least we should go for sadhya virechana. And sadhya omana with lavana jala, it's also good. Okay, in many patients with asthma, we told to just go for sadhya omana with lavana jala. So 70 to 80% relief will be there only with sadhya omana, lavana jala. Okay, and apta lavana abhyanga ಆ ತರದ್ದು ಮಾಡಬಹುದು. ಬಟ್ ಪಂಚಕರ್ಮದಲ್ಲಿ ನಾವು ಮಿನಿಯೇಚರ್ ಮಾಡಲ್ಸ್ ವಿ ಕ್ಯಾನ್ ಯೂಸ್. ಸದ್ಯ ಹೋಮನ, ಸದ್ಯ ವಿರೇಚನ, ಇವನ್ ಕ್ಲಾಸಿಕಲ್ ಬಸ್ತಿ ಇಲ್ಲ ಅಂತಂದ್ರೆ ಯು ಕ್ಯಾನ್ ಗೋ ವಿತ್ ಮಾತ್ರಾ ಬಸ್ತೀಸ್. ಸೊ ಶಿರಾವೇದನ, ಜಲೋಕನೇ ಬೇಕಂತಿಲ್ಲ, ವಿ ಕ್ಯಾನ್ ಗೋ ವಿತ್ ಶಿರಾವೇದನಲ್ಲಿ ಎಕ್ಸಲೆಂಟ್ ರಿಸಲ್ಟ್ಸ್ ಇದೆ, ಜಲೋಕ ಬೇಕಂತಿಲ್ಲ. ಬಟ್ ಇಫ್ ಯು ಗೋ ಫಾರ್ ಎ ಕ್ಲಾಸಿಕಲ್ ಟೈಪ್ ಆಫ್ ಪಂಚಕರ್ಮ, ಅಗೈನ್ ಎಕ್ಸಲೆಂಟ್ ರಿಸಲ್ಟ್ಸ್ ಯು ವಿಲ್ ಗೆಟ್. ಆತರ ಪ್ಲಾನ್ ಮಾಡ್ಬೋದು. ಅಂಡ್ ಧಾತು ಪಾಚಕಗಳಿಗೆಲ್ಲ ಅದ ವಿಷಮ ಜ್ವರ ಚಿಕಿತ್ಸೆದಲ್ಲಿ ಏನ್ ಪಾಚಕಗಳು ಹೇಳಿದ್ರೆ ಅವೆಲ್ಲ ಕೆಲಸ ಮಾಡ್ತಾವೆ.
ಓಕೆ ಸರ್, ಥ್ಯಾಂಕ್ ಯು.
And in Bhagna Chikitsa, Acharya Sushrutha told Taila Droni. Okay. Sandhana, for Bhagna Sandhana, Acharya Sushrutha told to lay down on Taila Droni for particular time, so that automatically it will heal. The Bhagna will heal automatically. So Taila Droni is advised in Bhagna Chikitsa, and Gruta Droni advised in Vata Vyadhi. If Vata Vyadhi is very chronic, unable to control with any of the interventions, Acharya told to do for Gruta Droni. Okay. One human body immerse ಆಗಬೇಕಂದ್ರೆ ಎಷ್ಟು ವೃತ್ತ ಬೇಕಾಗುತ್ತೆ, you can count it out. And Taila Droni also, we can reuse the oil by heating it up, and Gruta also we can reuse, but still it's a very expensive thing to do it. If the patient is willing, we can go with it. It's not so expensive if patient is good. Seed ಯಾವುದು, tub bath, oil tub bath and Gruta tub bath. It's a very unique concept.
ಓಕೆ.
Make an Ayurveda resort. You can plan for oil tub bath and ghee tub bath. You can charge 10,000 per session, 20,000 per session. So completely patient.
Too much expensive, sir.
ಹೌದು, ಅಲ್ಲ patient are ready.
Okay.
If they go to spa, they will charge for the general bath massage, they will charge like 10,000, 20,000. So we should target the money oriented patients. So we have patients for all types, even middle class, low middle class, higher middle class, and wealthy, rich. Every patients are there. If they don't, they have very good money, means they will spend. One is indication, and remaining is their wealth. Eradu ittantadre we can do it. But I have not seen Gruta Droni and Taila Droni anywhere in India. They are practicing. ಎಲ್ಲೂ ಇಲ್ಲ, ಎಲ್ಲೂ ಪ್ರಾಕ್ಟೀಸ್ ಮಾಡ್ತಾ ಇಲ್ಲ. ಇದನ್ನ ಪ್ಲಾನ್ ಮಾಡ್ಬೋದು, ಒಂದು ರೆಸಾರ್ಟ್ ಮಾಡಿ ವಿಲ್ ಪ್ಲಾನ್ Droni and Gruta Droni. Okay, so these are all some of the salient features of sushrutha samhita. ಆಯುಷ್ಮತಿ ಚರಕದಲ್ಲಿ ಕೂಡ ಇದೆ, ಅಂಡ್ ಸುಶ್ರುತದಲ್ಲಿ ಪ್ರಿಪರೇಷನ್ ಡೀಟೇಲ್ ಆಗಿ ಎಕ್ಸ್ಪ್ಲೇನ್ ಮಾಡಿದ್ದಾರೆ. ಬಟ್ ಒನ್ ಕಾಂಟ್ರವರ್ಷಿಯಲ್ ಥಿಂಗ್ ವಿತ್ ಸುಶ್ರುತ ಸಮೇತ ಇಸ್ ದಟ್ ಟೈಮ್ ಪೀರಿಯಡ್. Okay, so we don't know exact time period of Acharya Sushrutha. So somebody they told it is 1500 BC or 1000 BC, but no question will be asked regarding Sushrutha time period. Time period ಇಷ್ಟೇ ಅಂತ ನಾವು ಫಿಕ್ಸ್ ಮಾಡ್ಲಿಕ್ಕಾಗಲ್ಲ ಸುಶ್ರುತ ಸಮೇತದ್ದು. ಇಟ್ಸ್ ಲಿಟಲ್ ಬಿಟ್ ಕಾಂಟ್ರವರ್ಸಿ. But coming to the difficult levels of literature, difficult level of shlokas, compared to Charaka Samhita, Sushruta shlokas are very simple and easy to memorize. It means to say that after Dhanvantara Sampradaya, after Atreya Sampradaya, Dhanvantara Sampradaya was started. Or else the literature, what literature we got, Sushu Samhita, it is written after Charaka Samhita. Okay, but Charaka Samhita time period is fixed to 200 BC because of Kanishka dynasty. So Acharya Charaka lived during 200 BC, but documentation and other things was done before only. In many areas of Charaka Samhita, we have a reference of refer to Dhanvantara Sampradaya for surgical management. For example, in Udara Chikitsa, so in Jalodhara, Acharya explained about all the treatment principles and finally he told, so refer to Dhanvantara Sampradaya for further management. In Shota also he has referred to Dhanvantara Sampradaya. Okay. In Visha Chikitsa also he referred to Dhanvantara Sampradaya for further management. So like that in many areas of Charaka Samhita, he referred the patient to surgery. Okay. So nowadays the patient will come to Ayurveda to avoid surgery, but still we have extensive surgical practices in our olden days. ಏನಕ್ಕೆ ಆಯುರ್ವೇದ ಪೇಷಂಟ್ ಬರ್ತಿದ್ದಾರೆ ಇವಾಗ ತುಂಬಾ ಜನ ಅಂತ ಅಂದ್ರೆ ಟು ಅವಾಯ್ಡ್ ಸರ್ಜರಿ. ಸೊ ದೇ ಹ್ಯಾವ್ ಸಿವಿಯರ್ ಲೋ ಬ್ಯಾಕ್ ಏಕ್, ಡಿಸ್ಕ್ ಹರ್ನಿಯೇಷನ್, ಡಿಸ್ಕ್ ಕಟ್ ಆಗಿದೆ, ಅವ್ರ ಆಪರೇಷನ್ ಹೇಳಿದ್ರೆ ಇಲ್ಲ, ಯು ಮ್ಯಾನೇಜ್ ವಿತ್ ಮೆಡಿಸಿನ್ಸ್. ಅಂಡ್ ಸಿವಿಯರ್ ಆಸ್ಟಿಯೋಆರ್ಥರೈಟಿಸ್ ಗ್ರೇಡ್ 4, ಸೊ ಏನು ಉಳಿದಿಲ್ಲ ಬಟ್ ಸ್ಟಿಲ್ ದೇ ವಿಲ್ ಕಮ್ ಟು ಆಯುರ್ವೇದ. ಬಟ್ ವೆನ್
But
ರಷ್ಯಾಸ್ತ್ರ
some lot of patients have come in our clinic, sir.
ಹ್ಮ್
After surgery, post-operative infected is more, sir. That's why it's not going to surgery.
Post op ಅಲ್ಲ, ನಾಟ್ ಓನ್ಲಿ ಇನ್ಫೆಕ್ಷನ್ಸ್, ಸೊ post operative complications are very higher.
Yes,
Rehabilitation
sir.
will be there and malunion issues will be there. So once the structure is damaged, we cannot repair it properly. Then whatever natural structure given by God is, that is the final thing. So if any damage, any surgical damages happen, we cannot correct it very properly. Okay, damage is damage. So this about our father of surgery, Acharya Sushrutha, and this is some of the. This is about introduction of Sushrutha. It is not a detailed of Sushrutha. Detailed of Sushrutha, Dr. Aditya will do from chapter 1 to last chapter. This is only about
Okay.
introduction. Next comes Ashtanga Sangraha. So Tantrakarta is Ruddha Vagbata. He may belong to 600 AD. Ivrdu time period ನಮಗೆ exact ಇಲ್ಲ. So in question paper they won't ask about time period of Acharya Vagbata and Ruddha Vagbata and Laghu Vagbata, but ಸುಮ್ಮನೆ ಕೊಟ್ಟಿದ್ದಾರೆ ಅಷ್ಟೇ 600 AD. So total number of adhyayas is 150. Total number of thanas are 6. Sutrasthana has 40 chapters. So difference between Sutrasthana of Ashtanga Sangraha and Ashtanga Hridaya. Ashtanga Sangraha Sutrasthana contains 40. Ashtanga Hridaya Sutrasthana contains only 30. Ashtanga Hridaya Sutrasthana 30. Ashtanga Sangraha Sutrasthana 40. Okay. When comparing with Ashtanga Sangraha and Ashtanga Hridaya, there is no much difference. Okay, some extensive references will be there in Ashtanga Sangraha, some less references, and some compact version of Ashtanga Sangraha is Ashtanga Hridaya. Okay, so Ashtanga Sangraha is a comprehensive version. Ashtanga Hridaya is a compact version. Okay, so it's a big bus, that is a mini bus. Ashtanga Sangraha is a big bus, Ashtanga Hridaya is a mini bus, but both are bus with a good accommodation. Okay. When come to the new samhitas, means the first samhitas means Charaka and Sushrutha only. Remaining all other samhitas are copied Charaka and Sushrutha, are compiled Charaka and Sushrutha only. Even Ashtanga Hridaya is a compilation of Charaka and Sushrutha Samhita. He stolen the concept of Charaka and Sushrutha and he made and he wrote on its own experience or its own way. Okay, Charaka is famous in North India and Ashtanga Hridaya is famous in South India. Okay, in Kerala, so the first and foremost grantha they will read is Ashtanga Hridaya only. They won't read Charaka, they won't rely on Sushrutha. All slokas of Ashtanga Hridaya they will be well versed with Keralites. So, and they will practice Ashtanga Hridaya only. Okay, when come to Jamnagar and North India, so here extensively they will use Charaka Samhita. So when come to Karnataka, we are mixed up. We are in confusion whether we have to follow North India or whether we have to follow extensive South India. Okay, whether you use only kashayas or whether you have to use only rasaushadis. So in the confusion, we are using all the things. We are using rasaushadis, we are using kasavarishta, kashayas, everything. Okay. So Shashileka is a famous commentary written by Hindu in 10th century AD. ಅದೊಂದು ನೆನ್ಪಿಟ್ಕೊಳ್ಳಿ ಸರ್, ಶಶಿಲೇಖ ಕಾಮೆಂಟ್ರಿ ರಿಟರ್ನ್ ಬೈ ಹಿಂದೂ. ಹಿಂದಿ ಕಾಮೆಂಟ್ರೀಸ್ ಯೂಶಲಿ ಕೇಳಲ್ಲ. ಇಂಪಾರ್ಟೆಂಟ್ ಕಾಮೆಂಟ್ರಿ ಶಶಿಲೇಖ ರಿಟರ್ನ್ ಬೈ ಹಿಂದೂ. ಫೆಸಿಲಿಟೀಸ್ ಆಫ್ ಅಷ್ಟಾಂಗ ಸಂಗ್ರಹ. ಆಶ್ರಯಿ ಭಾವ ಸಂಬಂಧ. ದಿಸ್ ಈಸ್ ಎ ದೋಷ getting ashraya in dhatu. It's a very unique concept. When come to Charaka Samhita, so their pathology will start in dhatu. Dhatu samyam kriya shoktam tantra syasya. This is a shloka from Charaka Samhita. So the same thing is dosha vaishamyam. Dosha vaishamyam is the line taken in Ashtanga Hridaya and as well as in Sushu Samhita. But dhatu vaishamya is the concept used in Charaka Samhita. So when disease comes means it is because of dhatu vaishamya. In Ashtanga Hridaya and Sushu Samhita, the disease comes which is because of dosha vaishamya. So this concept was very clearly explained in Ashtanga Hridaya because of Ashri Bhava. There is no separate entity like dosha in the body. Doshas is incorporated in dhatus. Okay. So for example, Vata is situated in Asti. So Pitta is situated in Rakta and Sweda. Remaining all dhatus is the Ashraya of Kapha. Kapha is residing in remaining all other dhatus and Upadhatus and Malas of the body. Okay, so Vata is present in Asti. Okay, this is Ashri Bhava Sambandha. Okay, dosha alone will not do anything. So whatever presentation we will get in the body is because of dhatus. Okay, so dosha ಏನು ಒಂದೇ ಮಾಡಕ್ಕಾಗಲ್ಲ. ಅದೇನೇ ತೋರಿಸ್ಬೇಕಂತ ಅಂದ್ರೂ the face is dhatu. Doshas are invisible. Okay, the visible face in the body with the symptoms is dhatus only. Okay, Karsha Kashna Gatra Kampas Purana Krishna Kamita, where you will get? In Twak only. Where you will get Karsha? In the Twak. So Twak is Rasdhatu. Okay, whatever the thing, the presentation of doshas should be expressed in the form of dhatu. Doshas are not alone to express their symptoms. So doshas are residing in the dhatus. So whatever the expressions of doshas will come in the form of dhatu. Okay. So this is a very clear concept explained in Charaka Samhita. So Charaka believes and he thought everything is based on dhatu. So dhatu samyam kriya shoktam tantra syasya prayojanam. So what is the tantra prayojana is? We need to bring dhatus to samya avastha. Dhatu samyam kriya shoktam tantra syasya prayojanam. So not dosha samya. Bringing dosha to normalcy is highly difficult task. We cannot bring all dosha to the normalcy. We can bring all dhatus to the normalcy. Okay, so very clearly Acharya Charaka told dhatu samyam kriya shoktam tantra syasya prayojanam. Okay, dhatu samya is very clear. So this concept Ashri Bhava, it is there in Charaka Samhita, but separate shloka in the manner explained by Acharya Vagbhata. Ruddhi kshayas of dhatus depending on the dhatu agni. Yes, this is the unique concept. So Swadhatu Agni Kshaya will lead to what? Swadhatu Ruddhina Kshayana. For example, Rasadhatva Agni Kshaya will lead to Rasadhatu Ruddhina, Rasadhatu Kshayana. Swadhatu Agni Mandya will lead to Swadhatu Ruddhina, Swadhatu Kshayana. Question clear ಇದೆಯಾ? ನಾನು ಕೇಳ್ತಿರೋ ಕ್ವಶನ್ ಕ್ಲಿಯರ್ ಇದೆ ನಿಮ್ಗೆ? ಸೊ ಫಾರ್ ಎಕ್ಸಾಂಪಲ್, ಮೇಧೋಧಾತ್ವಾಗ್ನಿ ಕ್ಷಯದಲ್ಲಿ ಮೇಧೋಧಾತು ವೃದ್ಧಿ ಆಗತ್ತಾ, ಮೇಧೋಧಾತು ಕ್ಷಯ ಆಗತ್ತಾ? ಮೇಧೋಧಾತ್ವಾಗ್ನಿ ಕ್ಷಯದಲ್ಲಿ, ಮೇಧೋಧಾತ್ವಾಗ್ನಿ ಮಾಂದ್ಯದಲ್ಲಿ ಮೇಧೋಧಾತು ಅಗ್ನಿ ಮಂದ ಆಗಿದೆ. ಅವಾಗ ಮೇಧೋಧಾತು ವೃದ್ಧಿ ಆಗುತ್ತಾ, ಮೇಧೋಧಾತು ಕ್ಷಯ ಆಗುತ್ತಾ?
ವೃದ್ಧಿ.
ವೃದ್ಧಿ. ಸ್ವಾತಿ, ಅಕಾರ್ಡಿಂಗ್ ಟು ಇಟ್ ಇಸ್ ವೃದ್ಧಿ. ಅದರ್ಸ್? ಶ್ರುತಿ, ಲಕ್ಷ್ಮೀಶ್, ಗೀತಾ, ಪ್ರಿಯಾ, ಪ್ರಿಯಾಂಕಾ. So Swati has given her opinion. So Swadhatu Agnimanda will lead to Swadhatu Ruddhi. Others? Fatapat.
ವೃದ್ಧಿ ಸರ್.
Ruddhi. Good. ಬೇರೆ? ಗೀತಾ, ಶ್ರುತಿ, ಲಕ್ಷ್ಮೀಶ್, ಯಾರು ಹೇಳಿ ಪರವಾಗಿಲ್ಲ. ವೃದ್ಧಿ ಆಗ್ಲಿ ಕ್ಷಯ ಆಗ್ಲಿ, ಆನ್ಸರ್ ಆಮೇಲೆ ನೋಡೋಣ. ಕ್ಷಯ. ಓಕೆ, ಗುಡ್. ನೆಕ್ಸ್ಟ್ ಶ್ರುತಿ, ಲಕ್ಷ್ಮೀಶ್, ಸಂತೋಷ್.
ವೃದ್ಧಿ ಸರ್. ವೃದ್ಧಿ ಆಯ್ತು ಅಂದ ತಕ್ಷಣ ಅದು ಅಗ್ನಿಮಾಂದ್ಯ ಆಗೇ ಆಗುತ್ತೆ ಸರ್ ಆಟೋಮೆಟಿಕ್ ಆಗಿ.
ಅಲ್ಲ, ಅಗ್ನಿಮಾನ್ಯದ ವೃದ್ಧಿ ಆಗ್ತಾ ಇದೆ. So because of Agnimandya of the particular dhatu, the Swadhatu Ruddhi will going to happen. Okay, so for example, according to Dhatu Poshana Nyaya, so the nutrition will come and land in the particular dhatu. So if the Agni is there in the particular dhatu, that will utilize the Poshana and Sarakita Vibhajana will going to happen. That Sara Bhaga will utilize by the same dhatu and as well as it will supply to the next dhatu. This is the supply chain. This is a supply chain happening in dhatus. If Swadhatu Agni Mandya happens, so the nutrition will come and stuck in the same dhatu only. That leads to Swadhatu Ruddhi. So Dhatvagni Mandya will lead to Swadhatu Ruddhi. It is not Kshaya. Okay, Swati is correct and Priyanka is correct. Geeta, correct yourself. It is Swadhatu Agni Mandya. The Dhatvagni Mandya will lead to Dhatu Ruddhi. Okay. So in case of obesity, what we need to correct is, we need to correct Rasadhatu, we need to correct Raktadhatu, we need to correct Mamsadhatu, and we need to correct Medodhatvagni. Then only so the obesity or we can weight loss can be achieved. Okay. So Rasa, Rakta, Mamsa ella correction ಮಾಡಿ ಮೇಧೋಧಾತ್ವಾಗ್ನಿ correction ಮಾಡಿದ್ರೆ so obesity correction ಆಗುತ್ತೆ. ಸೊ ಅದಕ್ಕೆ ಎಲ್ಲದನ್ನು ಕರೆಕ್ಷನ್ ಮಾಡ್ಬೇಕಂತಂದ್ರೆ ಅಪತರ್ಪಣ ಎಲ್ಲಿ ಮಾಡ್ಬೇಕು, ಪಂಚಕರ್ಮ ಎಲ್ಲಿ ಮಾಡ್ಬೇಕು, ಎಲ್ಲದನ್ನು ಪ್ಲಾನ್ ಮಾಡಿ ಮಾಡ್ಬೇಕಾಗತ್ತೆ. ಇಟ್ಸ್ ನಾಟ್ ಎ ಸಿಂಪಲ್ ಥಿಂಗ್. ದಿಸ್ ಯೂನಿಕ್ ಕಾನ್ಸೆಪ್ಟ್ ಈಸ್ ಎಕ್ಸ್ಪ್ಲೈನ್ಡ್ ಇನ್ ಅಷ್ಟಾಂಗ ಸಂಗ್ರಹ, ಧಾತ್ವಾಗ್ನಿ ಕಾನ್ಸೆಪ್ಟ್. ಸೊ ಮೆನ್ಷನ್ ನ್ಯೂ ಡ್ರಗ್ ಲೈಕ್ ಅಗ್ರೇಯ ಪ್ರಕರಣ. ಸೊ ಅಗ್ರೇಯ ಸಂಗ್ರಹ ಅಧ್ಯಾಯ ಇಸ್ ದೇರ್ ಇನ್ ಚರಕ ಸಂಹಿತ. ಇಟ್ಸ್ ನಾಟ್ ಇನ್ ದ ನೇಮ್ ಆಫ್ ಅಗ್ರೇಯ ಸಂಗ್ರಹ, ಬಟ್ ದೇ ಎಕ್ಸ್ಪ್ಲೈನ್ಡ್. Okay, but in Ashtanga Sangraha, he dedicated one chapter in Sutrasana, 13th chapter. The name of the chapter is 13. The number is 13th chapter. Name is Agraya Sangrahani Adhyaya. Okay, he has dedicated one chapter for Agrayas. So this is a unique concept. And Charakadali 352 Agrayas ಹೇಳಿದ್ದಾರೆ, but Ashtanga Sangrahadalli 355 ಹೇಳಿದ್ದಾರೆ. 355. So mention that excess usage of Gugulu leads to chlebia. Yes. So if you use Gugulu in excess, it may lead to chlebia. So special types of jwara like pralepaka jwara, vata balasaka jwara, aridraka jwara, used first time in Ashtanga Sangraha. The usage of Kampilaka bark as a purgation, yes, the first time. Introduction of Vatsaka Digana, yes. Panchamula, Jivaniya Panchamula Gana, Panchamulas quoted by sushrutha. Panchamula sushrutha ಇದೆ, but Madhyama Panchamula and Jivaniya Panchamula introduced by Ashtanga Sangraha. So Drakshasa Acharya mentioned in Madhya Varga, Vargikarana, Dravadravya Vargikaranadalli idu concept ಬರುತ್ತೆ. He quoted the duration of digestion of food is Samagni as 4 yama and digestion of medicine is 2 yamas. Yes. Very good concept. So Samagni Daga food digestion will take 4 yamas. So medicine digestion will take 2 yamas. So it means 1 yama is how many hours? 1 yama is how many hours?
3 hours sir.
3 hours. ಸೊ ಇಲ್ಲ ಆಚಾರ್ಯ ಏನ್ ಮಾಡ್ತಾರೆ, 12 ಅವರ್ ಕಂಪ್ಲೀಟ್ ಡೈಜೆಷನ್ ಆಗ್ಲಿಕ್ಕೆ ಬೇಕಂತ ಹೇಳ್ತಾರೆ. ಸೊ ನೈಟ್ ಫುಡ್ ಇಂದ ಮಾರ್ನಿಂಗ್ ಫುಡ್ಗೆ ವಿ ಶುಡ್ ಗಿವ್ ಅಟ್ ಲೀಸ್ಟ್ 12 hours ಆಫ್ ಗ್ಯಾಪ್. ಸೊ ಇಟ್ ಈಸ್ ಎ ಕಂಪ್ಲೀಟ್ ಡೈಜೆಷನ್. What Acharya told is it's for a complete digestion, starting from the mouth till it will reaches the anus. That is the time duration for digestion. So not digestion in the stomach, not digestion in small intestine. Okay, if you just open modern books also, so how much hours it will take for complete digestion? It may take 12 hours. Acharya is very correct in that manner. And medicine, complete medicine absorption, excretion, it will take 6 hours. Absorption and excretion. Some medicines will not absorb quickly and excrete quickly. 90% of medicines will absorb and excrete within 6 hours. So it's not an allopathy medicine, it's an Ayurveda medicines. Okay, now we have a coated medicines, bypassing the stomach. Okay, entry coated. Okay, rabiprazole and other some medicines are entry coated. Entry coated means so they will dissolve only in the intestine. So in the stomach, if there is no digestion of the medicines, it will enter into the intestine. And some medicine it is like SD, sustained release, SR. Okay, SR means sustained release. So after taking the medicine, immediately it won't absorb, it won't digest. Slowly it will absorb, slowly it will digest. For example, common drug is Oviran SR. So diclofenac sodium with sustained release. It will release it slowly. It will take 12 hours to release. Okay. So it is modern type, but in Ayurveda, we have very clear herbal medicines will absorb and digestion, everything will happen within 2 yamas, within 6 hours. Manifestation of Kamala alone without Pandaroga. Yes, Kamala may directly happen without Pandaroga. So we have two diseases with alcoholic fatty liver and non-alcoholic fatty liver. Okay. So alcoholic fatty liver is directly Kamala. Non-alcoholic fatty liver is Pandrogokta Kamala. Okay. Fatty changes it may happen. So describe 94 Netra, describe 12 Balagrahas. Therapeutic use of Visha introduced by Ruddha Vagbata. Yes. Urdhva Guda. So this is an intestinal obstruction. Urdhva Guda is a disease called as intestinal obstruction. There is an obstruction for the fecal matter to go towards the anal route. So then it has reversed to the oral route. That is called as Urdhva Guda. Okay, intestinal obstruction. Urdhva Guda is a disease of intestinal obstruction. First Acharya documented Urdhva Guda. 26 types of Shastra. Yes. Five types of Kalpa. First time mentioned. Rutu Sandhi. Yes. Mahamayura Vidya. Basmaka Roga. Okay. Shiva Gotika first time. Explanation of Vajikarana. Pralepa. Okay. Just go through it. The salient features of Ashtanga Sangraha. When come to Ashtanga Hridaya is Tantrakarta is Laghu Akbata belong to 7th century AD. Maybe. The time period is not exact. So total number of chapters 120. The chapter numbers goes like this. Just copy and memorize. So commentaries, just go through it. Important commentaries. When come to the commentaries of Ashtanga Hridaya, two commentaries are very famous. So one is Sarvanga Sundara Tika, written by Arunadatta, 30th century. Second commentary is Ayurveda Rasayana, written by A. Madri. Out of these two, which is a complete commentary of Ashtanga Hridaya? They written commentary on all the chapters of Ashtanga Hridaya. It is A. Madri commentary. So A. Madri commentary is complete and full. Okay. So Sarvanga Sundara is not a complete commentary on Ashtanga Hridaya. So partial commentary there. But if you purchase a book with Sanskrit explanation, Sanskrit shloka with commentary, you will get both the commentaries, Ashtanga Hridaya and as well as Ayurveda Rasayana and Sarvanga Sundara. Both commentaries you will get. If you purchase any Ashtanga Hridaya book with a commentary, you will get both the commentaries. Sanskrit book. These two commentaries are important. Note it down. Sarvanga Sundara written by Arunadatta, belongs to 13th century AD. Ayurveda Rasayana written by Emade, 13th century AD. Remaining, just go through it. You can document it. 35 commentaries documented. Specialties of Ashtanga Hridaya. So Ardhaka and one thing, good thing about Ashtanga Hridaya is, so many practical things they fetched up, and many of their experiences was documented. So when come to Ashtanga Sangraha, just like a poetic and very extensive explanation was written in Ashtanga Sangraha, but in Ashtanga Hridaya, very apt explanation, very compact explanation was done. Ardhaka is mentioned in Arita Varga. So vegetables ಅಲ್ಲಿ they added Ardhaka. ವಿಪಾಕಕ್ಕೆ ಫಸ್ಟ್ ಡೆಫಿನೇಷನ್ಸ್ ಹೇಳಿದ್ದು ಇನ್ ಅಷ್ಟಾಂಗ ಹೃದಯ. Introduce few new agriya dravyas. So some of the agriya dravyas told. So how agriya dravyas is told in Ashtanga Hridaya is Jwara means Musta Parpataka. Musta Parpataka you give, definitely Jwara will come down. No other extra thing he has told. So Jwara means Musta Parpataka. Give Musta and Parpataka, Jwara will go down. So and in Prameha is Amalaki, Liharoga, Pippali, Vatarakta, Guduchi, single herbal drug. So no extra thing to be think about the drug. Directly we can advise. Okay. So Vata Kapha Vikara Haritaki, Basti Roga Shilajitu, Chardi Laja, Laja Peya, Jwara Mustaparpataka, yes, Staulia Rasanjana. So like that there are 100 drugs documented. Just go through it. So by next class, everyone should memorize agrayas of Charaka, agrayas of Ashtanga Sangraha, and agrayas of Ashtanga Hridaya. This is the homework. So everyone should come with a complete homework. Sadhya Sneha in Sneha Prakarana, introduction of Damani Marma in Marma Prakarana. So this is the new concept, Damani Marma. Damani Marma is not all explained in Sushu Samhita. He only added Damani Marma. Okay. So this is about Ashtanga Sangraha. Like Sharangadhara Samhita, go through Sharanga Samhita, 32 chapters and 2600 shlokas, only 3 sthanas. And commentaries of Ashtanga Sharangadhara is very important. Deepika, Godartha Deepika, Ayurveda Deepika commentary. Just go through it with their timeline. And Sharangadhara is the first and foremost Vaisheshya Kalpana textbook. Okay, so in Charaka Sushrutha Vagbada, there is no medical medicine preparation explanation. How to prepare Swaras, how to prepare Kashaya, how to prepare Arka. No explanation was found in Charaka Sushrutha Samhitas in detail. But Sharangadhara, so he solved many of the doubts of Charaka Sushrutha and Vagbada Samhita. They mentioned about the drug, they didn't mention described about how to prepare the drug. So all these answers we will get it from Sharangadhara Samhita. It is the first foremost Vaisheshya Kalpana textbook. So just go through it. Nadi Prakarana first explaining Sharangadhara Samhita. We will discuss Sharangadhara Samhita in detail after finish of this. Just go through some salient features of Sharangadhara Samhita. Whatever given here is a very important salient features. Just go through it. Next, Madhav Nidana. It is a complete compilation of Charaka and Sushrutha. Which is best in Charaka he has taken, which is best in Sushrutha he has taken. 99% copied Madhav Nidana. No, nothing new is there in Madhav Nidana. Just go through it. New things was mentioned here. So like that, Bhava Prakasha is also 100% copy from Charaka, Sushrutha, Vagbata, Yogaratnakara, all his previous books. Okay, it's almost Bhava Prakasha 16th century. So it's a copied one only. Just go through it. But the important thing is it's Nigantu, Bhava Prakasha Nigantu. So detailed drug collection is there. Commentaries and other things. Go through it. Kashyapa Samhita. Why Kashyapa is not comes under Bruhatrai? Because it is partially available. Otherwise, we can add Kashyapa as one of the Bruhatrai. Charaka, Sushrutha and Kashyapa, we may make it as a Bruhatrai, but it is partially available. That's why we cannot call it as a Bruhatrai. It's also called as Ruddha Jivaka Tantra. So Jivaka wrote Kashyapa Samhita on its 5th age. 5 ವರ್ಷ ಇರ್ಬೇಕಾದ್ರೆ ನಮ್ಗೆ ಓದಕ್ಕೆ ಬರೆಯಕ್ಕೆ ಬರ್ತಾ ಇರ್ಲಿಲ್ಲ. So Acharya Jivaka wrote a book, that is a medical textbook. So it is from his Acharya. Upadishta is Marshi Kashyapa, belong to 6th century AD. Tantrakarta is Buddha Jivaka. Pratisamskarta is Vatsya. They will ask the question regarding Vatsya. Who is the Pratisamskarta of Kashyap Samhita? Is Vatsya.
What?
Adhyas and sthanas, just go through it. So like that, same like that of Charaka Samhita, but Kilastara is added extra 200 chapters. Then total it becomes 80 chapters in Kilastana, total 200 chapters. 120 plus 80 of Kilastana becomes 200 chapters in Kashyap Samhita. So specialties of Kashyap Samhita, Pancha Rudaya. How, where you will get 5 Rudayas in the body? Only one Rudaya we have. In Charaka Samhita, sushrutha, but everywhere we have got only one Rudaya. One is Uro Rudaya. The heart present in the chest is Uro Rudaya. Remaining 4 Rudayas are Tala Rudaya. Tala Rudaya is a marma. Okay, so here 2 in the hands and 2 in the legs. There are 4 Rudayas. It's called as Tala Rudaya. Okay, so 4 Tala Rudaya and 1 Uro Rudaya, totally 5 Rudayas. So Ashtavidha Sveda. So the Kashyapa Samhita is predominantly a pediatric textbook, and the gynecology and obstetrics also explained well. Okay, so just go through the salient features of Kashyapa Samhita. And Bela and Harita is not at all a original text. So many concepts are against Charaka, against Sushrutha. So just go through this, the chapters, number of chapters and their contributions. And some extra things was mentioned here. Just go through Bela and Harita specialties. Kalyana Karaka, some important text mentioned with the name of the author. Just go through it. Some synonyms of acharyas. So China physician is Maharshi Pangu. So the European physician is Hiranyaksha. Just go through it. Some important years. Foundation of Sanskrit College in Calcutta. CCM Act 1970. CCM came into force from 1971. UNICEF established. Just go through it. Important committees and the recommendations. Yes, it's a very important, and you need to remember the date. When Boer committee it is in 1945, the government of India medicine should be given to states. So central authority will be given to the states like that. So Pandit committee 1949, foundation of PG institution in Jamnagar. So PG institution started in Jamnagar 1956, but the foundation stone was done by Pandit committee. Okay, like that you continue. And important days, so very neatly chart has made. Higher centers of Ayurveda and their governing bodies, just go through it. Important journals. So first journal of Ayurveda is Arogya Sudhanidhi 1901. You just remember that one. It's more than enough. So next journal is Sudhanidhi 1907. Just go through it. Okay. So this is about Ayurveda Ithiasa. So you read once again in detail about Ayurveda Ithiasa. So this Sunday you have a test on Ayurveda Ithiasa. Okay. This time is enough now. Another 3 days time is there. This is Wednesday, Thursday, Friday, and Saturday. Read completely, memorize completely, along with Rashastra history and Dravyaguna history. Okay. Apart from this, they will ask the questions regarding the Rashastra history and Dravyaguna history. You will just read from dependent sources and get ready for the test on Sunday. Okay. After Rashastra, we'll start some other subject, not from first year. You can select second year or third year subject after this Ithiasa.
Okay. Thank you, sir.
Okay, good night. Bye bye.
Good night, sir. Good night, sir.